The next speaker is DawnLoughborough, and I must say, I don't think we're going to have time for you to read this entire document. So if we only have 5 minutes, it's going to have to be abridged.
Hello, my name is DawnLoughborough, and I'm the mother of 3 great children, one with autism. I'm here today to convey physiological medical concerns and want to influence the standard of care for autism as a special patient population. The autism community wants hospitals and clinicians who are well educated and prepared for patients with autism. One could consider an autism care model similar to like St. Jude's approach to children's cancer, where the finest teams work together to facilitate clinical treatments and inform mainstream medical hospitals. This approach would improve quality of care and potentially lower the costs by improving our children's long-term health outcomes. It would guide delivery of care regarding considerations for drug interactions, anesthesia selection, and follow-on care. Regardless of whether you are agnostic about the cause of regressive autism or, like many parents, observe cascading vaccine-induced developmental regression, quite often regressive autism manifests with massive inflammation which alters multiple systems in the body, including the immune system, digestion, and the nervous system. These children cannot detoxify well. They have sensitivities and sensory problems. Without a special population standard of care, our children's symptoms are often overlooked as being part of the way it is for autism, resulting in a type of discrimination that's impeding the coordination of care. Our children need the same medical investigation as any other population and perhaps need more specific workups to pre-screen for life-saving preconditions that impact things like their anesthesia selection. If an autistic child comes to the ER with abdominal pain, are they given the same medical workups to rule out concerns like appendicitis, or are they dismissed with a bottle of laxatives since they have autism? The relevance here is that IACC exists to coordinate autism. Autistic children are physically ill and require accurate diagnosis and appropriate treatment and quality of care. I also ask that you go back to the IOM to do the Gen Zero studies and the health outcomes studies. I saw a little boy 4 days ago on the news. He was banging his head left to right, completely bloody, and his parents have looked for medical interventions. They're doing pretty well, but this is kind of common in our population. So here are some general concerns. One, the intake analysis. It really lacks the collection of medical and physiological data. So our medical intake diagnostics, specific, when you go to a hospital, specific to regressive autism, are absent from intake at hospitals and clinics. A child with autism, including Medicaid patients, should be screened just like any other patient population. But when physicians hear the child is autistic, many are discriminated against and their physiology dismissed as behavior or assumption of that is how it is for autism. 2, medical management of adverse events. Emergency room staff and pediatricians' offices need to be trained to recognize drug and vaccine reactions, so they may start interventions immediately to reduce the impact of adverse events. 3, medical screening needs to be developed. An example is that mitochondrial disorders are not rare, but rather a common issue with regressive autism. Our children should be screened for mitochondrial disorders. Patients should be referred to the proper immunologist, if they need a gastrointestinal specialist, or a neurologist for screenings. This is just simply not happening. Many of these screenings are not in place in clinical settings for our autism population, and children go underdiagnosed. Seizures are underdiagnosed. 60% of autistic patients have seizure disorder or abnormal brain activity, often affecting speech and movement and social disorders. Many children do not have their seizures detected because they are not referred to a neurologist for an EEG to look at their brain activity. 5, immune system and gastrointestinal problems are disregarded. Faulty immune systems and severe gastrointestinal symptoms occur in a large percentage of autistic children. Sensitivities and allergies impact drug selection and anesthesia. Proper investigation of and diagnosis is rarely made, and the lack of investigation is nothing short of medical neglect for our children. In other populations, endoscopy and colonoscopy are the standard that would be applied when they present with the same persistent severe symptoms for bowel disease. When treated appropriately, we're finding drastic improvements, including behavioral. 6, detox mechanisms are subpar. Children with autism are not effective excretors. And 7, last, current infectious disease management is not specific to individual needs. Policies are needed for extensive coordination of care. I hope this shines some light on some of the very basic issues families are dealing with.
Want to go outside?
Since 1998, I've had parent mentoring conversations with these families, and this is our reality. We are everywhere. Thank you for the agency's time. I hope you include us in your strategies going forward.
Thank you. And again, I'd ask people